Good evening, I'm Chris Hensing. This is CBC Windsor News, our digital show that we've been offering here during the pandemic. COVID-19, a weekend that was long as we saw numbers jump across southwestern Ontario. Let's get right into the latest here for the Windsor-Essex region. According to the Windsor-Essex County Health Unit, 44 confirmed COVID-19 cases as of this morning, a jump of 19 from Sunday. Now, part of the reason that we've seen this is because of the testing kits. You'll remember that London has opened up, or we were told was going to open up a testing facility that would allow our tests to go there instead of to Toronto. For some people, it's been about 7 days waiting for that test to come. Some have had more, reportedly. According to the Chief Medical Officer of Health, Dr. Ahmed, he says, we expected that increase because of our backlog of tests. Tests should now return within 24 to 48 hours. And for a lot of people, that's why this has become that key week period to start to see some of the measures we've put in place of social distancing, physical distancing, and what's taken place from there. We've also heard from the province that that 50 group is no longer the case. If you want to go outside or interact with people in a way that is safe under public health rules, 5 people is the amount that they're letting groups congregate in. Another big moment that happened this morning was Dr. Ahmed was asked, how bad is it, the idea of community transmission? That's when we start to see cases of COVID-19 that are positive within our community where you can't trace back international travel. Now, for the first bit, we saw a lot of cases that were coming in from across the border. They're not releasing individual case histories at this point because of the amount, but Dr. Ahmed says that it is bad and that a lot of it has to do, they say, with people who are not taking that self-isolation call seriously. Another thing that we expected to see here is that March break return point for people in Ontario, and that's something that we've been watching here closely as people are told once again, if you have international travel and you are coming back, to remember to self-isolate. This morning, I was able to speak with somebody in Chatham, Kent, where there are 6 confirmed positive cases of COVID-19. Someone who is COVID-19 positive. His name is Luke Davidson, and he walked me through what it was like for him to deal with all of this, what it was like to feel positive for COVID-19, the symptoms that he was experiencing, and what this journey has been like for him. We're going to get to him in a moment, but first I want to start to head over to our Jason Vio. Jason is one of our reporters who's working from home, out of office, if you will, because of the changes we've made here because of COVID-19. Jason, just as I pull you up here, you've been covering a pretty tragic story. The numbers of confirmed cases are up, but there have also been 4 deaths in Sarnia-Lambton. What can you tell us about what's happening there?
That's right, Chris. 4 confirmed deaths related to COVID-19 in Sarnia-Lambton. 3 of those are specific to one seniors home in Sarnia. That's Landmark Village. The health unit isn't releasing specific details about the 28 confirmed cases in Sarnia-Lambton or any of the deaths that we've seen so far in that community. And we've also left messages with that seniors home. We haven't heard back. But here's what we do know about Landmark Village. It has 123 apartment-style units on 4 floors. Some of them are 2-bedroom suites. And now here's what we know about the 28 confirmed COVID cases in Sarnia-Lambton. 92% are people ages 60 and over, and 42% of the 28 cases are above the age of 80. Wow. Now that's especially concerning because, as we've heard over and over again, people ages 65 and over have an increased risk of more severe outcomes if they get COVID-19, but that also includes people with a compromised immune system and those with underlying medical conditions. Public health continues to urge physical distancing, as we've heard time and time again, to kind of limit and prevent the spread of COVID-19. But they didn't answer any of our questions today in regards to these deaths, specifically those connected to the seniors home, the 3 of them that are linked to Landmark Village, including what's being done at that seniors home to prevent further spread of the coronavirus. Now, we are expecting to learn those details hopefully tomorrow, and I'll be on the Lambton Public Health teleconference getting those answers as well, Chris.
I appreciate that, Jason. It's interesting to see how quickly this happens. Last week, they had their first 5 confirmed cases, and now the tragic news of these deaths. We'll keep an eye on this story closely.
Thanks, Chris.
And that's something that we've seen in other parts of the province here as well. When you think of Bobcaygeon, that's the place where this morning people woke up to the news of 9 seniors that had died, and we're getting more details again and again about the way that the testing is going for COVID-19 in our province, but also the idea of how this is affecting families and what people are going through during all of this. The main thing here again, as we start to see these numbers and they go higher and higher, is remembering that these are in fact people that are dealing with just extenuating circumstances, and really I can only imagine what some of these families are going through. Another thing that we've been watching very closely here is what's happening at the border. Now, we know that there are thousands of people that cross across the border every single day from the Windsor-Essex region into the Michigan area that are in the healthcare industry. It could be between 1,500 to 2,000 people. Now, we have heard from our MPs here that have sent letters to the federal government, and I'm going to start with an update here from Liberal MP Irg Kuzmarchek. He says, on Monday, March 23rd, I spoke with Dr. Ahmed, the medical officer of health at the Windsor-Essex County Health Unit. He and his team appraised me of their concerns regarding the escalating situation in Detroit and their recommendation to close the border to essential workers, including nurses. Now, I've asked the Windsor-Essex County Health Unit about that. They did not respond to my questions today. We'll bring it up at the morning briefing tomorrow. But this is something that we've seen echoed as well by Brian Massey. He's the NDP MP, and you would recognize him from Windsor West, which is where both the tunnel and the Ambassador Bridge are located. Now, he wrote to the federal government today, or I'm sorry, on the weekend, asking again for more measures. I want to point out some of the specific ones that he's pointed out here, talking about actions that, and I'm quoting here, could include potential options such as heightened and expansive daily screening for each health worker, segregation of returning health workers to designated housing away from their homes, and possibly requiring health workers who cross the border daily to stay in the United States. Now, again, this is something that we're following closely here, trying to get government reaction as well. These are just some of the suggestions that are being put forward by our local MPs, and a story that we'll be watching closely. Over the weekend, I was able to speak with Jenna Malosh. She is a nurse who lives in Amherstburg and works at Henry Ford in Detroit, one of the hospitals that are hardest hit. It's been called a hotspot, Detroit, because of the numbers of COVID-related positive tests that have come through, as well as the deaths. At one point on the weekend, they had almost had as many new cases in Michigan as there were entirely in our province of Ontario. Now, Jenna Malosh, who is a registered nurse, lives in Amherstburg with her parents, says that when she crosses the border, she feels safe going in. They are asking more questions about what she's going through, and when she comes back, she's told about some of the risks that are associated with crossing the border and working in Detroit. She says when she gets home, she goes into a garage, she changes there, uses a separate bathroom, and then when she's finished there, if she's in a common area with her parents, she's always wearing PPE, a mask, a face mask like you've seen. Now, that's the extreme measures that she has taken. When she comes back home, she self-isolates, she's not going out while doing this, while working on the front lines of this pandemic, but she says she is looking at another place, an Airbnb to rent, so that she can isolate even further away from her family. Again, it's just some of the suggestions of what people have, the members of parliament for our area have put forward to the federal government as it relates to the border and our border community. Sticking with transportation here, I want to bring in the CBC's Tamina Aziz. Tamina, when we were chatting on Friday, you were covering the story of Transit Windsor. Now, Sunday, the brakes were put on all the buses after that last shift, and this morning, transit was stopped, suspended. What's the latest that you've heard today?
Yeah, that's right, Chris. It's a new reality for those in Windsor who rely on Transit Windsor to get around the city, including essential workers who need to get to work. This includes Stephen Druin. He works at a convenience store and he relies on the bus services in this city to get to work. And now he says he's being put in an uncomfortable situation to ask his friends who want to stay safe, they want to practice physical distancing, for a ride to work. He says that biking and walking aren't ideal for him. He lives too far from work. It would take about an hour and a half to walk to work for him and a $16 cab ride, which adds up. Sticking with that, he says that there has been a lack of planning on the city's part when it came to this announcement. And his story, among others, inspired Jessica Bondy to launch a petition to ask for Ontario Premier Doug Ford to declare public transit as an essential service. She launched it just a day ago and it has more than 650 signatures. So that's a good amount of people here in Windsor alone who support her idea and to reverse that decision that Drew Dilkens made last week. Now, others like Carol Muir agrees with Mayor Drew Dilkens. She supports the idea to see these bus services being suspended for 2 weeks. She says it will help prevent the spread of the virus, and she compares it to riding a plane or a train, saying that it's hard to keep people distanced and separated in such small spaces. Now, I spoke with Ward 3 Councillor Reno Bordelin. He is opposed to the idea. He says it wasn't a council decision, but if it was, he would have voted against it. He says it's because the city declared a state of emergency, which allowed Drew Dilkens to make that decision. But he also says that these concerns about cleanliness and keeping these buses clean have been moved from buses to cabs and taxis and Ubers, and he doesn't know whether these cab companies or these Uber drivers have any cleaning protocols put in place right now. But now that this decision has been made, it started today, in fact, the city is looking into ways to compensate those who rely on other means to get to work and to offset some of the cost of traveling. One possibility is a voucher system for cabs. It was just an idea that he threw at me when I spoke with him earlier today, but once that decision has been made and any sort of measure they want to put in place, they'll make that announcement. But again, there isn't anything put in place at the moment. Druin says that it would be amazing if there is any measures to offset that cost. Chris.
It's interesting to hear from that essential service, right? If they're going to have the convenience store open, how does one person get from point A to point B? And then that call from Dilkens when we were talking to him on Friday about the idea of volunteers. So it'll be interesting to see how the community steps up to replace the system that has now been pulled away. Thanks, Tamina. One of the things we've been watching closely here, especially within our area, is the size of our region and where these cases, these COVID-19 cases, are coming from. On the weekend here, Chatham-Kent saw that there are now 6 positive COVID-19 cases. And I'm just going to go and set up here a piece of an interview that I had done with Luke Davidson about what life is like for somebody who has tested positive for COVID-19. And just as I bring it up here, I want to remind people that they did say, according to the president and CEO of Chatham-Kent's Health Alliance, that they are seeing in Chatham-Kent 100 staff and 17 physicians that are currently self-isolating at home because of COVID-19. So when we think about all the people that are affected, it's important to note that healthcare workers can be part of that. Now, I'm just pulling up here again my conversation that I had with Luke Davidson. This is a man who's 38 years old, lives in Chatham-Kent, was returning back from a trip in Nashville and decided because of the international travel that he had taken to self-isolate, which was the requirement, but then from there realized that he was showing symptoms for COVID-19. And here's some of the conversation that I had with him earlier today.
Please, honestly, like I'm hearing that we have patients on this floor right now that aren't doing as well as I am. Let's not have you in that situation, or your family members, or someone who you may come in contact with, who you possibly spread it with. Please don't do that. Just stay home. Just stay home. Allow this virus to play its course, and if we can all do this together, we will beat this. That's the only way. Honestly, that's the only way we're going to do this together.
How are you feeling right now?
Feeling much better. I felt like death earlier, for sure. Probably the worst sickness that I've ever had. But definitely much better.
For someone who's gone through this process, can you take us through what life was like for you? I guess once you returned back from Nashville, if that's okay.
Yeah, for sure. It started slow, like just a tightness in my chest on the first night back, or second night back rather. And about 2 days after that, for about 8 days straight, my skin hurt. Like it literally, like the fabric of my clothes would literally, like it would hurt, but it would touch my skin. Lost my appetite, couldn't keep food down.
For those 8 days when you had that fever, what were you doing to keep not only yourself safe, but the community safe? Were you following that self-isolation?
Yeah, for sure. Yeah, staying like downstairs in my house. And it was like, I can't stress that enough, how important that is. That, when you're not feeling good, or in my case, if you're away, to stay home. Like the Prime Minister and the Premier, they wouldn't be this, like, adamant about it if it wasn't as important as it is. Like, if I can only imagine if I was out in the community, just, you know, and I'm an avid social media guy, and like, I love hanging out with people. It'd break my heart if I knew that I was literally getting people sick.
When you did get tested, can you walk us through what that felt like?
That was, let me tell you, that was a test, my friend. When I was sitting in the back of the ER, and the nurse, she pulls out this like 7-inch long thin dipstick, and she's like, "All right, I'm gonna put this in your nose," and I'm like, "How far?" And she's like, "All the way," and I'm like, "Oh Lord, have mercy." And so they literally stick it all the way in, and then like spin it around, tickling the bottom of your actual brain. It is not a comfortable. It's not a comfortable test at all, but one that definitely has to happen for sure.
When you got the test, how long did you have to wait for your results? We've heard that for some people it's taking up to 7 days, maybe more.
Yeah. So I was tested on Thursday, and I got my results back Saturday. So only about 2 days.
During those 2-day period, were you in the hospital?
Yes. Yeah. They admitted me right away because one, trying to get my fever down, but they were really looking at my oxygen levels. Oxygen levels were not where they needed to be.
When you look at what's been helpful for you, we talk about being a social media guy, have there been moments with your family, friends, where they've been able to help you through this?
Oh, unbelievable. Like, I think I would probably be going crazy in this one-room hospital room, but I have been, like, my social media, it's been crazy. My story has been shared thousands of times now, and people have reached out in my community. People who I don't even know have reached out to me saying, "We've never met. You're part of our community. Thank you for sharing your story. We're here for you. Can we drop groceries off to your family? Can we do anything?" It's amazing. Honestly, like, I am so proud to be part of this community and be proud to have so many great friends. I really am.
It's a nice way to end that there. That, again, is Luke Davidson. He lives in Chatham, Kent, has tested positive for COVID-19. He says now he's feeling healthy, or healthier than he once was. And it was nice to just get an update on what life is like for somebody. We've talked about so many case numbers, so to have a sense of what it feels like to go through that. Again, the latest that we have out of our Windsor-Essex County Health Unit is that there are 44 confirmed positive cases in our region. There are 4 people who have died of COVID-19 in Sarnia-Lambton, 3 of them belonging to a seniors residence and assisted living community. And as far as what's happening in Chatham-Kent, as of late this afternoon, there were 6 confirmed positive cases, and that there, Luke Davidson was one of them. And as you heard him from the beginning, he talked about how some other people in that hospital are not doing as well as he is, and that call once again from him for people to continue to physical distance and to make sure that they are doing everything they can to stop the spread of the coronavirus. Thanks again for watching. This has been our CBC digital offering of the news that you need to know today. Just a reminder that Windsor Morning, of course, always has you set to start your day in what is a very, very fast-moving world right now. That's Tony Doucette in the mornings, and we also have our afternoon drive team. And for any more on any of these stories, you can always go to our website, cbc.ca/Windsor. Thanks for watching.